Let's bring in one of our legislators, State Senator from Michigan's 8th District out in Shelby Township, the Republican, Pete Lucido, on the other end of our line. He's got some legislation aimed at COVID-19 and trying to stop the transfer of the virus, but we'll get into that in just a moment. First of all, Senator, I want to wish you good morning. Thanks for being with us.
Good morning, Frank. Great to always be with you and the listeners of this great state.
So give me your reaction to this whole boat caper where the governor says at one point, it didn't. She tells legislative leaders, oh, that's not true when the story's breaking. And then she comes out of her press conference midweek and says, well, it was just a joke. Yeah, he said it, but it was just a joke. And that just defies any logic whatsoever. It's not a joke.
I agree with you. I think her husband owes a gratitude of going ahead and saying, thanks for the cover, honey. But truthfully, he's got to come forward and say what he said, not the cover up of the governor. The husband himself has to stand and man up, as I say, go forward and at least answer the questions, because the boat owner, or the boat livery, if you will, has no motive to lie, no motive to say anything but the truth. It is what it is.
Exactly. And so, we're left with the governor to explain this at this press. I call them press events now. They're not press conferences. And she can say what she wants there. She's never challenged because there are no follow-up questions. And she's got her friends in the media who will write in her support all day and all night and all week long. So, at any rate, that's fine. It's fine that she has her supporters. In the legislature, though, all of you in the Senate and over in the House are trying to figure out ways that we can continue to address this virus here in our state. And your new legislation is aiming to do just that, isn't it?
I've had it, Frank. It's appalling. It's disgusting. We have the most vulnerable people in the state of Michigan inside of long-term nursing care. They're in there for a reason, specifically to get the care that they need to maintain their life. And as a result, to utilize these nursing care facilities as regional hubs, as her director indicated, and to put them into that position with COVID, to put people that are infected into a long-term nursing care that takes care of our loved ones, our beloved seniors, our greatest generation, the people that can't care for themselves, to stick them in a facility that doesn't have these items that are CDC guidelines. Who's checking the guidelines during this COVID epidemic? No, pandemic. And at the end of the day, what are we trying to accomplish here? We're trying to accomplish what? Try to keep people healthy, I thought. That's what DHHS, Department of Health and Human Services, are supposed to do. We've had 2 oversight committee hearings, and I've asked numerous questions of the director. I've asked what caused this policy to occur when you set up the TCF, the old Cobo Hall, with thousands of beds, thousands of dollars of taxpayers, millions of dollars of taxpayers, as well as the Novi Expo. Why wasn't these utilized to keep the infected individuals out of the nursing center? Just recently, you saw the debacle, the uncalled for, of a 20-year-old male who beat a 75-year-old U.S. Army veteran who was defenseless in a bed because that individual came out of a hospital with COVID, and they shipped him to a nursing facility. And under whose authority was this? Our governor. Nobody else is going to say that this is the right thing to do because it's a bad policy and it needs to be changed. And State Senator Pete Lucido is just the one to put the bill in now that says this is totally unacceptable, this is inhumane, and I want it changed now. Stop it. Do not put people in a facility where you know that the personnel are going back and forth, and PPE equipment is scarce at the time when this all happened because hospitals were fighting for it.
And
I see no logic, I see no data, I see no science that supports any of this. Idiotic.
Well,
of human beings.
I'll tell you this: there is no disputing the fact that the death rate is higher among older people in our state and across the country. They're always most vulnerable. Those in nursing homes who have pre-existing conditions are obviously vulnerable to it, and this virus has shown no mercy on them. And so we thank you for thinking of them.
You know what? You put those first and foremost because look who we learned from, Frank. It's the individuals that actually have the experience and the knowledge that came earlier than we did. We are going to be there one day, hopefully later than sooner, but at the end of the day, we have to would step up and say, look, protect these individuals. Do not bring anything that is going to harm them, including a virus that's going to kill them, into a facility where we had a hospital in Wayne, Frank. It was the Beaumont Hospital that closed down and laid off 4,000 people that were skilled, trained medical personnel. And no one wants to deal with a COVID patient. I get it. And I applaud those first line fighters, I call them, that are out there doing what they're doing. But if we would have put everybody that had COVID into one separate unit and kept people there that were trained to skill their services to take care of them, why did we resource them into these regional hubs at $5,000 extra a bed? That's what the incentive was, to keep a bed available, $5,000 extra dollars in addition to any Medicare, Medicaid, or private pay. You're incentivizing putting virus in a very, very dispositional, in his state, position to harm the very essence of the people we're supposed to protect.
Yeah, amen to that. And you know what? It's being ignored by much of the so-called media that is supposed to cover this. So we thank you for bringing it up and looking out for those folks who are most vulnerable. We have seen them. They've got the highest death tolls, and they've done the most for our country in their lifetimes as well. So we thank them for that and pray that this virus passes for all of us sometime very soon. Senator Pete Lucido, thanks for being with us. Good luck with this legislation. We'll talk again soon, okay?
Amen, Frank. Amen.
All right, brother. Talk to you later.